Hello and welcome to Let's Talk CNAs, a show for CNAs by CNAs. I'm your host Wendell and this is my lovely co-host Angel.
Hello, and we are here at the Innovative School of Health Sciences in Phoenix, Arizona.
Yay, yay!
And today's subject is all about CPR.
That's right, Angel. And did you know that the American Heart Association estimates that 100,000 to 200 adult or children lives could be saved if CPR was performed early enough?
Well, that's good to know, Wendell. And that's why it's very important that we all participate in learning how to do CPR.
That's right, Angel. Well, today promised to be a very exciting show. Are you ready to start?
I sure am, Wendell.
Well, in that case, let's pump it up. Let's have a conversation.
Let's talk CNA. Let's talk CNA. Let's talk CNA. Let's have a conversation.
So, Tammy, thank you for being here on the show with us.
Well, thank you for having me.
Yeah, it's good to have you on the show. So, Tammy, tell us a little something about yourself.
Well, my name is Tammy White, and I am the founder and owner of Innovative School of Health Sciences. And here we offer CPR courses as well as certified caregiver courses. We are actually, I'm pretty pleased to say, top in the state right now.
All right.
I'm pretty happy about that. I have been a CPR instructor for actually this year, 20 years now.
Wow.
20 years,
Okay,
yes.
Congratulations.
And I remember when it seemed like a whole bunch of complex steps to where we've streamlined it to where we're at now.
Oh, that's
All right. Well, that's awesome, Tammy. So we asked 25 CNAs what would be the question they would want to ask the CPR instructor. So their question was, what is the acronym of AED?
Well, Wendell, AED, that acronym stands for Automated External Defibrillation.
Ooh.
And it is actually a portable device
Okay.
that when you're trained in the right class, usually it's a healthcare provider level or heart saver, that you can use it to shock the heart if someone was in cardiac arrest.
Okay.
And it would restore them into a normal rhythm.
Okay.
Oh,
Okay.
wow.
Okay. So is that only used during a cardio incident, or it can be used for anyone that you're performing CPR?
Well, ideally, what you want is if you have an AED in your facility, what you want to do is go ahead and get it, because once you apply it to the victim, it's only going to shock a shockable rhythm. So it's not going to just shock someone that's in a normal heart rhythm. It's going to be ventricular fibrillation, also known as VFib. It's also going to shock some other types of dysrhythmias. So it's a safe piece of equipment to use once you've been trained.
Okay, that's nice. So I hope that answered you guys' question. So here's our first question to you, Tammy. What is the acronym for CPR?
Oh boy, that's a hard one. Okay. Cardiopulmonary resuscitation.
Okay. All right.
And that's something that a lot of people do not know. So make sure you pay attention as you're taking the CPR course. That's what it stands for.
For sure. And really, you just break those words apart, because cardio is for heart and pulmonary is referring to lung. And so when we're performing the chest compressions and we're giving breaths, cardiopulmonary resuscitation.
Yeah, and that truly makes sense. But in most cases, you know, everybody just say, we need CPR, we need to perform CPR. In most cases, you know. But okay, thank you very much for that.
Thank you. All right. So my question to you is, what situation would constitute the use of CPR?
That's a great question. What situation? Well, first of all, they would not be breathing, so you would not have a visible chest rise. Also, if you are a healthcare provider, you would not palpate a pulse. Usually we would palpate the carotid pulse in your neck. If it's a heart saver level, which is more geared for lay rescuers, we would not teach them to palpate the carotid pulse. We would just say if there's an absence of signs of life. So there's obviously no breathing and they look dead.
Right.
Just to be pretty
Oh, wow.
straightforward.
Okay.
Wow, I never heard it put that way before.
Yeah, me neither.
But it makes sense though, right?
Yes.
It makes sense. Yeah, I never heard it put that way before. So one time, Tam, I was at a restaurant and a couple was sitting across from me, and I happened to notice that this guy was, like if he was choking, wasn't sure if he was choking to this day, but he was making all these kind of signs. But what would be the universal sign that someone was choking?
Great question. The universal sign is typically clutching your throat.
Okay.
That's
Like
usually
so.
the universal sign, and that's in any CPR class that you go to.
Okay.
However, watching people who really experience choking, sometimes they don't clutch their throat.
Right.
Sometimes like they're clutching for something
Yes.
that may or may not be there. I've seen them grab their chest. I've seen them grab their belly. I've seen them grab people.
Right.
So, it just depends, but the universal sign is clutching your throat.
Okay. I can remember one time, this is funny, I remember one time when I was probably about in the 2nd grade, I remember I stole a piece of potato out the bowl that Mom was making up. She was getting ready to make some, I think, mashed potatoes. And I was like, because I was trying to hurry up and eat it, you know?
Wow.
And I know I was doing like this, but at the same time, I didn't want her to know that I stole the potato. So I was like trying to really get it up, So it's good to know that if you do this, that generally means that people know that something is going on with you, that you need some type of system.
And I'd like to add that a person that is choking, they're not going to be able to talk. They're not going to be able to squeal or anything. You're not going to hear anything. You may hear some coughing, but that's kind of more of a partial blockage.
Right.
But it is certainly an indication that something is happening to that airway.
Okay.
So they're saying, "Oh, I'm choking."
You're not
They're
choking.
not choking.
You're not choking. Drink you some water, smaller bites, you'll be fine.
Exactly. And there was a gentleman, I was at my facility, and he couldn't really move his arms like that, or, how would you, I see that he was turning like red and blue. That's how I think, and I've seen him kind of like, So that's how I seen that he was choking, and I had to do the Heimlich maneuver on him, and it came up, but he couldn't move his arms or anything like that. So, but I just wanted to point that out.
You actually make a good point, because someone that could not clutch their throat, you certainly would see changes. If there is a blockage in the airway, they're going to turn blue, which is we usually call cyanosis. They'll become cyanotic. They may even get really pale. Their eyes may water. Sometimes you'll even see their nose running. You'll see eyes looking like they're protruding outward.
Right.
Things like that. So you make a really good point.
Sounds good.
Thank you. And what was the name of that?
Cyanosis or cyanotic. So
Cyanotic.
it's that
Okay.
blue color that any of us in the healthcare industry we probably have seen from time to time.
Okay.
Yeah, we really see that a lot too.
Okay, so what is the proper compression to breath ratios?
That's a great question. So it's 30 compressions to 2 breaths.
2 breaths.
30 to 2.
Breath.
Now that's with adult CPR. If even if it's 2-person, but if it was a child or infant, it would actually be 15 to 2 with 2-person rescuer.
Okay.
Single rescuer is always 30 to 2.
Okay. All right. Awesome.
Okay. So if it was what would it be if it was so you say adult, it would be 30 to 2.
It's always 30 to 2 with adult, whether it's single or 2-person rescuer, but it does differ when it comes to children. So it's usually for 2-person rescuer, it's going to be 15 to 2.
Okay. So is there a certain age that you consider adult if someone was performing CPR?
Well, we try to stay away from specific ages just because, children they differ in size.
Okay.
So basically you just say from 8 to signs of puberty or something like that, 8 or up, you're going to consider them as an adult.
Oh, okay.
So,
That's
but then
awesome.
you do have some that may look considerably younger,
Right, right.
but you wouldn't know that,
Exactly.
because you don't know that particular victim that you're working with.
Right. That is correct. All right. Well, Tammy, can you give us a demonstration of a CPR rescue and a Heimlich maneuver?
Certainly.
All right. Well, let's go do that. Tammy's going to give us a demonstration, and we'll be right back.
John, are you okay? He's not breathing. His chest isn't rising or falling. I need help.
Someone call 911.
Pulse. Have to start CPR, expose the chest. We're gonna make sure we go put our heel of our hand to the lower part of the breastbone and begin compressions. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Let's remove this pillow. Give them breaths. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. And you would continue to do this until there were signs of life or EMS came in, which is 911 came in and they took over.
Okay. So exactly what would be the sign of life?
Well, you might see him cough. You might see movement. He might start to vomit. Okay. Those kind of things. He may even gasp. And depending on, because some gasp, you may still have to continue to do CPR. They're called agonal gasp. But you may see like a normal breathing pattern take place. And so in that case, you would go ahead and you would stop, and you can actually, catch my breath.
It is hard performance.
It is some work. But you could turn them in a recovery position on their side. You may also, in facilities, we have crash carts. So we have suction equipment and things like that that can help us. And I do want to add that you have to make sure when you perform chest compressions, they're being done on a firm, flat surface. Okay.
Is he choking?
Are you choking? I can help you. So you want to stand behind them. You want to identify where the belly button is. You want to make a fist and put it above the belly button and take your other hand and put it over it. And you want to put inward, push inward and upward motions forcefully until the object comes out. You'll continue to do this, or he's going to go unconscious if that object doesn't move. Okay? Did it come out?
Yes.
Okay. How you doing?
Better, thank you.
Okay. If he would have gone unconscious, what would have happened is we would have begun CPR. And what we would have done is in between the chest compressions and the breaths, we would check the mouth to see if we see the object. If we see it, we'll pull it out. If we don't see it, we would not attempt a blind finger sweep.
Okay. Thank you. Well, Angel, today was another great informative show.
It sure was, Wendell. So let's
Pump it up.
And make sure you check us out on YouTube, Instagram, Facebook, and Twitter.
That's right. Well, we want to thank our special guest, Tammy, for being on the show. And we want to thank you for watching the show. And we'll see you next time on Let's Talk CNAs, where knowledge is empowerment. Boom, boom.
Let's have a conversation.